So twin transfusion syndrome is when two babies who are sharing a placenta share multiple blood vessels, and for whatever reason, whichever theory you decide to ascribe to, one baby starts to get too much of the blood flow, one baby's not getting enough of the blood flow, and so you end up with one small twin, one large twin. Talking to patients, often the grandmother will say, "Oh, I had a stuck twin," and what they're referring to is what's now been recognized as twin-to-twin transfusion syndrome. And those were identical twins where one of them essentially has no fluid and one has a lot of extra fluid. And then there's multiple criteria we look at to categorize these babies. We look at their bladders to see if they're filling their bladders, which is a reflection of whether or not their kidneys are working well. We look at blood flow in the brain. We look at how the heart is functioning. Often these babies will develop a form of what's called cardiomyopathy or heart failure that really has an impact on how well those babies do and what the prognosis is for those babies. And if that's not recognized, then those babies can be missed, and that can really affect their outcomes and what the chances are for those babies to survive. So there's a laundry list of things we keep an eye on when we're following moms for possible twin-to-twin transfusion syndrome. And babies don't share well, and anybody who's got more than one kid knows kids don't share well, and it still applies, especially even to twin-to-twin transfusion syndrome. And there's lots of research going on, and there's lots of good places in the country that are doing good research on what to do next. But as it stands right now, we've got great methods to identify kids who are having problems by ultrasound. Once we've got them identified, there's great places we can send them to get treatment.